If you've ever gotten a splinter from a deck, fence, piece of wood, or a thorn bush, you know how painful they can be. The biggest mistake people make is either digging around blindly with tweezers or simply leaving it in, hoping that it comes out on its own. As a wound care specialist, I'm going to show you how to remove it safely, how to clean the area afterwards, and how to recognize signs of infection. Step 1, before you start digging around, clean the skin. Wash the area with soapy water or saline. This removes the dirt and bacteria from the surface and reduces the risk of introducing bacteria deeper into the skin while you're trying to remove the splinter. Step 2, if part of the splinter is sticking out of the skin, removal is usually straightforward. Use clean tweezers, grab the exposed end, and pull in the same direction that it entered. Avoid twisting or breaking it. The goal is to remove it in one piece. If the splinter breaks, smaller fragments can remain under the skin and continue to cause problems. Step 3, if the splinter is completely buried underneath the skin, don't start aggressively digging. This often creates a larger wound than the splinter itself. Instead, soak the area in warm water for 10 to 15 minutes and repeat this several times throughout the day. Sometimes the skin softens enough that the splinter works its way out closer to the surface. For deeper wound splinters or thorns, medical removal may be the safest option. Step 4, once the splinter is out, we need to treat the wound. Wash the area again with soapy water or saline and pat dry. At this point, I like to apply a small amount of petroleum jelly, as a lot of people think the wound needs to dry out, but in reality, wounds generally heal a lot better in a moist environment. The petroleum jelly helps protect the wound, prevent excess drying, and also supports healing. Step 5, if the area is on a finger, hand, foot, or somewhere that gets rubbed frequently, cover it with a simple bandage. If the wound's a little bit bigger after removal, a non-stick dressing does work well too. The goal is to simply keep it clean and protected while it heals. Most splinter wounds heal without any problems. However, watch for increased redness, increased pain, swelling, warmth, yellow or green drainage, or a small pocket of pus. These are signs that bacteria may have entered the wound. Seek medical attention if you can't remove the splinter, part of the splinter breaks off, the area becomes infected, the splinter is very deep or near a joint, tendon, or under a fingernail, and if you have diabetes, poor circulation, or a weakened immune system. Don't wait too long to have this assessed. If you get a splinter, clean the area first, remove it carefully, clean the wound again, apply a small amount of petroleum jelly, cover it if needed, and watch for signs of infection. Most splinters are simple to deal with, but removing them properly can prevent a bigger problem later. And remember, understanding a wound is the first step towards healing it. Head to thewoundconsultant.com for expert wound care consultations, practical guides, and educational books, your go-to resource for smarter wound healing.